Now, as we said, about 80% of the population will experience a back problem at some point in their life, but there are things that can increase your risk besides aging. So we're going to look at them with Dr. Mena. The first one, obviously getting older. Poor physical fitness, that's a big one.
Poor physical fitness, the muscles are not, patients, they're not moving around, they're not getting those muscles properly fit, and they can cause weakness in the musculature, and that can lead you into all the pressure. Normally it's being transferred, all the load is being transferred to the spine, and already it's being, when someone has degenerative changes, already the areas are weak, and that can cause you pain. Being overweight as well, that's something that not only for spine or pain, we talk to that about in cardiovascular, with cholesterol, people that have diabetes. Normally being overweight is a risk factor for pretty much every single condition. Other diseases, depending on the type of disease that we're talking about, people that they do have hip problems, the way that they're walking, they can cause problems into the back because of the gait alterations. The job, if you work either construction or heavy laboring, that you're lifting heavy stuff all day, but also being sedentary, sitting all day at work, can also cause you back problems as well. And definitely smoking, if you smoke, you're constricting the small blood vessels that they supply the muscles and the different structures in the body, that can lead you into having back problems as well.
Can being fit from a young age to, obviously your 20s, 30s, can that help you avoid getting much of this that we've been talking about? It can,
definitely, because you're more used to be in a regular activity program, using the exercise as part of your daily living. So it's easier and I see that on patients, it's easier for those patients to get accustomed into an exercise program. Also, you have to be careful on the type of activity that you have been doing also, because sometimes depending on the type of sports that patients have been dealing with throughout their life, that can also affect the back, especially gymnastics, football injuries, those things that over time they can accumulate, and they can lead you to having spine problems.